Medical interviews are among the most challenging and high-stakes conversations an aspiring doctor will ever face. They are not just about testing your academic knowledge but also about understanding your motivations, values, and character. Admissions panels and recruiters want to know whether you truly have the qualities needed to thrive in the demanding world of medicine. For this reason, they design questions that assess your ability to communicate clearly, think ethically, and show empathy while balancing logic and professionalism. What makes medical interview questions unique is that they often combine personal reflection with situational judgment. You might be asked about your past experiences, your reasons for pursuing medicine, or how you would handle ethical dilemmas. In other moments, you may face scenario-based questions that challenge you to think critically under pressure. This guide walks through some of the most frequently asked medical interview questions, with clear answers and practical tips to help you prepare. If you practice these responses, adapt them to your own story, and stay authentic, you'll enter the interview room with confidence. Question 1. Why do you want to become a doctor? This is the single most common and important medical interview question. The panel wants to know what drives you to choose this demanding career. Here's the answer. My motivation to pursue medicine comes from a combination of science and service. During my high school years, I volunteered at a local clinic and saw firsthand how doctors could bring not only healing but also comfort to patients and their families. That experience showed me that medicine is about much more than treating illnesses. It is about building trust, providing hope, and improving quality of life. For me, becoming a doctor means combining my passion for science with a lifelong commitment to helping others. Tip: avoid cliché answers like, "I want to help people." Give concrete examples and personal experiences that shaped your decision. Question 2. What qualities make a good doctor? This question checks whether you understand that medicine is as much about character as it is about knowledge. Here's the answer. A good doctor must have strong communication skills to explain complex medical information in a clear and compassionate way. Empathy is essential because patients often feel anxious or vulnerable, and they need to feel understood. Resilience is equally important since doctors face long hours and high-pressure situations. Lastly, integrity and professionalism ensure that patients can trust their doctor to act ethically and responsibly. A good doctor is someone who blends knowledge, compassion, and reliability. Tip: don't just list qualities. Explain why they matter and give context for how you've demonstrated them. Question 3. Tell us about a time when you faced a challenge and how you overcame it. Medical schools and hospitals want candidates who are resilient and adaptable. Here's the answer. During my final year at university, I was leading a group project that required significant coordination. Midway through, 2 team members disagreed strongly about how to proceed, and progress stalled. Instead of letting the conflict grow, I organized a short meeting where each member could present their ideas. We discussed openly, weighed the pros and cons, and eventually combined the best parts of both approaches. Not only did we finish on time, but our project received excellent feedback. The experience taught me the value of patience, mediation, and teamwork under pressure. Tip: choose a real-life example, and use the STAR method, situation, task, action, result, to structure your response. Question 4. How do you handle stress and long working hours? This question measures your emotional resilience and coping strategies. Here's the answer. I manage stress by staying organized and breaking tasks into smaller, achievable steps. I also make sure to maintain balance by exercising regularly and setting aside time for friends and hobbies. When I feel overwhelmed, I pause, reprioritize, and sometimes talk through challenges with a mentor. These strategies have helped me stay calm and effective even during busy academic periods and volunteer work at the hospital. I believe having healthy outlets is essential to sustaining a career in medicine. Tip: never say you don't get stressed. That sounds unrealistic. Instead, highlight healthy and professional coping mechanisms. Question 5. What do you think are the biggest challenges facing healthcare today? This checks your awareness of broader medical issues and your ability to think critically. Here's the answer. One of the biggest challenges is ensuring equal access to healthcare. Many people around the world still lack affordable and timely medical care. Another challenge is the rise of chronic conditions like diabetes and heart disease, which put pressure on healthcare systems. Advances in technology are also changing medicine, which is exciting, but they raise concerns about patient data privacy and equitable access. As future doctors, we need to adapt to these challenges while striving for solutions that improve both care quality and accessibility. Tip: be balanced. Show that you're aware of the difficulties but also optimistic about future solutions. Question 6. How would you approach an ethical dilemma, such as when a patient refuses treatment? Ethical awareness is a cornerstone of good medical practice. Here's the answer. If a patient refuses treatment, my first step would be to ensure they fully understand the risks and consequences of their decision. I would explain the situation in simple, compassionate language, answering any questions they have. If the patient still refuses and is capable of making an informed choice, I would respect their autonomy. While it can be difficult to accept, respecting patient rights is an essential part of being a doctor. Tip: show that you understand ethical principles like autonomy, beneficence, non-maleficence, and justice. Question 7. How do you prioritize tasks when everything seems important? This question tests your time management and decision-making under pressure. Here's the answer. When faced with multiple urgent tasks, I use a prioritization method that focuses on both urgency and impact. I ask myself which tasks have immediate consequences for patient safety or critical deadlines. Those become my top priority. At the same time, I make sure to communicate with colleagues if priorities clash. For example, during my internship, I had to prepare a report while also assisting with patient intake. I prioritized patient care first but scheduled report writing in focus blocks later that day. This way, nothing was neglected. Tip: mention frameworks or strategies you use, like checklists, digital planners, or the Eisenhower matrix. Employers like structure. Question 8. Where do you see yourself in 10 years? This is about your long-term vision in medicine. Here's the answer. In 10 years, I see myself as a fully qualified doctor, possibly specializing in a field that allows me to combine direct patient care with research. I also want to be involved in community health initiatives because I believe preventive care is just as important as treatment. Beyond that, I hope to mentor medical students and contribute to the next generation of healthcare professionals. Tip: keep your answer ambitious but realistic. Show commitment to growth without being overly rigid. Question 9. How do you balance empathy with professional boundaries? Doctors must connect deeply with patients but also maintain objectivity. Here's the answer. I believe empathy is about listening carefully and validating the patient's feelings, but professional boundaries ensure that I remain objective. For example, offering reassurance and kindness is essential, but allowing emotions to overwhelm me could cloud my judgment. The balance lies in caring deeply for patients while still maintaining the clarity needed to make the best medical decisions. Tip: show maturity and self-awareness. Employers want to see that you understand the emotional side of medicine. Closing thoughts. Medical interview questions are carefully designed to reveal not just your academic readiness but also your character, motivation, and resilience. They test whether you can handle ethical challenges, manage stress, and communicate with empathy. By preparing well, reflecting on personal experiences, and practicing aloud, you can develop answers that sound both confident and authentic. Remember, interviewers are not searching for perfect candidates. They are looking for individuals with curiosity, compassion, and a genuine passion for medicine. If you show that you understand the responsibilities of a medical career, respect patients, and are committed to lifelong learning, you will stand out as a strong candidate. So as you step into your medical interview, stay calm, trust your preparation, and remember why you chose this path. Medicine is not just a profession, it is a calling. And if you communicate that sincerely, your interviewers will recognize it.